Hi and welcome back to the Insurance Basics series. In this video, we're going to be talking about copayment or copays, so let's get started. What is a copayment? A copayment, which is commonly referred to as a copay, is a fixed dollar amount that you pay prior to receiving services. This is typically what a policyholder pays out of pocket when they make an appointment or before receiving a covered healthcare service. Are copays only for health insurance? So copays are not exclusively associated to health insurance plans. There are other types of insurance plans that also have copays, but they all are under the umbrella of health, so to speak. So you have it with general healthcare plans, you have it with prescription plans, you have it with dental insurance plans, vision insurance plans. In some instances, you might have a mental health insurance plan. You might also have this with long-term care insurance. So you might have a different copay for in-home health aides versus like a step-down hospital or a nursing home. And lastly, another insurance type that might have copays is pet insurance, which covers their health insurance for pets. How are copays different from deductibles? Well, a deductible is a total that a policyholder must pay for covered services prior to insurance stepping in. So it's different from an out-of-pocket max, but again, a deductible is what you pay out of pocket for covered services. So those are services that your insurance is willing to pay for, but until you meet the deductible, the insurance company is not going to pay for them. So if you want some more information about deductibles, you can check out this video. Do copays count towards your deductible? This honestly depends on your personal insurance policy. Some do consider it a part of your deductible, but many do not. So you just have to look into your policy terms to determine whether or not the deductible includes copays. What types of services usually have a copay? The types of services that generally have a copay would be your PCP, so visiting your primary care physician. You will have a different copay for most insurances for a specialist, so thinking like a rheumatologist, neurologist, those type of specialty doctors that you don't see on a frequent basis. Other things could be like your prescription medication, as well as if you are getting additional therapy, so considering mental health therapy, but also like physical therapy, and in some cases speech or vision therapy. Lastly, you have to also think that there is sometimes a difference in pay for emergency room care, hospital stays, and lastly, in urgent care might be different than what you would pay going to your primary care physician. Are copays required for preventive services? Under many insurance plans, preventative care such as vaccinations, annual screenings, pap smears, and annual physicals are generally included, or you don't have to pay copay as they are deductible waived. So if you have no idea what I'm referring to, here is a video on deductible waivers, which explains why certain preventative services are covered for free. Can copays vary based off of the type of service or provider? So yes, copays can vary dependent on the type of service you will be receiving, what is the type of care that you will be getting, so who is it from? Is it from your PCP? Is it from a specialist? Is it in an inpatient surgery location or an outpatient surgery location? There's also whether or not it is in-network versus out-of-network. So there are some factors that play into what copay is applicable at the time of service. Do you have to pay a copay for every visit? Generally, yes. Almost all of your visits are going to have some sort of copay attached. However, for the preventative services that I talked about earlier, those generally do not have that copay attached to them. How much are typical copays? So copays vary widely, and so I'm just going to give you a range, but please note that again, it is a range and it could definitely be much higher, or in some cases it could be free. It's really dependent on the policy, but in general, for your primary care physician, it's between like $10 to $50. For specialty visits, then it's generally between $35 and up. So $35 would be like a really, really good plan, but in most cases it is between like $50 to like $150. Now, there's also generally a difference when it comes to emergency room versus urgent care. However, I couldn't find a good range on that because different plans kind of like change what they count as urgent care versus non-urgent care. So it was just too confusing. So again, it is dependent on your insurance plan. And yes, it can differ based off of which plan you go with. It could even be the same company and there will be different deductibles, different copays, etc. What happens if you don't pay your copay copay at time of service. So generally, a healthcare provider is usually pretty good at collecting your copay at time of service, but in case it didn't go through or if there was a problem, then generally you'll receive a bill in the mail for it. Now, with some healthcare providers, they may attach a late fee. That is up to the healthcare provider and their policies. So that is something that you need to check in with, and that's something that is generally stated within that packet new patient paperwork. Generally, it includes their fees for things or if things bounce, etc. Are medications subject to copays? Generally, yes. Medications are subject to copays, and it kind of varies based off of a couple of things. So one is, what type of tier medication is it? I don't know what makes one a tier 1 versus a tier 2 versus a tier 3, but there are different tiers of medication. And so medication that falls in a tier 1 generally has like one copay, tier 2 has a different copay, tier 3 has another copay. Another thing that is in consideration is its formulary. So whether or not it is like the name brand version or if there is a generic version. So in general, generics are cheaper than the name brand. But for some people, they can't take the generic and they have to be on the name brand. And so those are things that you have to consider. Can copays change during your policy term? Generally, no. Copays shouldn't change during your policy term. The only way that those would change would be if you had a plan renewal and at that plan renewal those things changed, or if you switched plans during that calendar year, then yes, you would be subject to the new plans policies and their copays. Do you have to pay a copay if you have secondary insurance? So this kind of depends on your secondary insurance. Some will kick in and take over for your copays from your primary, and some will not do that. So that is dependent on your particular insurance case. Is there a limit to how much you will pay in copays within a year? So most insurance plans do have what is called an out-of-pocket maximum. An out-of-pocket maximum generally does include copays, but sometimes it does not. So it's not a universal rule, and that's something that you need to check into. In most cases, yes. So the out-of-pocket max includes the deductible, your copays, your co-insurance. What that means is within a given year, that is the max amount that you are going to have to pay while you have that insurance. So if your out-of-pocket max is $5,000, then that means you pay max $5,000 for your medical services, and the rest of the services that are delivered within that year will be covered by your health insurance company. Now, again, I want to mention that in general, in most cases, yes, your copays are included in that out-of-pocket max, but I have seen some policies that do not count it. Are copays refundable if your insurance company denies the claim? Generally, copays are not refundable. So even if your insurance company denies the claim, your co-payment generally just gets applied to the total for that service. So whatever the billable amount is, your copay generally gets attached to that. So that way you lower it by that amount. If you have a situation in which your health insurance company denies your claim, you can call your insurance company and fight it to get the claim reprocessed and approved. But if that doesn't happen, I recommend that you talk to the healthcare provider, because oftentimes they have programs or incentives if you cash pay where they can do a discount or put it on a payment plan and hopefully make it more affordable for you. So yeah, that's the basics around co-payments or copays. I hope you found this video helpful. It would be an honor if you would give this video a like. As always, if you have any questions, feel free to drop a comment down below. I am a one-woman team, so I will be the one that is answering them, and it's always cool just to say hi because, hey, I love saying hi to other people. Now, if you are a returning subscriber, thank you so much for tuning in yet again. I hope this video was something that answered a question for you, and if not, feel free to also drop a comment down below with your questions, because it makes it so much easier to make videos on things that people want to know about. Now, for those of you who are not subscribers, I hope that you will consider subscribing to this channel. Every week, I try to post a video about a personal finance topic, and then once a month, I post about my debts totals. So that way, I am as transparent as I can be with you, so that way you understand these topics and realize that talking about money is not something that is shameful or scary. I hope you have a great one. Until the next video, bye!